our YouTube channel. Today we are going to learn about gastritis. Please subscribe to our YouTube channel, share it with your family and friends. You will get many health related videos on this channel. Please watch this video till end to get complete information of gastritis. Our stomach wall is composed of three layers. There is a protective lining of mucus called mucosa. This lining protects your stomach from strong stomach acid that digests food. When something damages or weakens this protective lining, the mucosa inflamed, causing gastritis. Gastritis is inflammation of lining of stomach. The inflammation of gastritis is most often the result of infection with the same bacterium that causes most stomach ulcers and regular use of certain pain relievers. The bacteria break down the stomach protective lining and cause inflammation. Now let's talk about signs and symptoms of gastritis. Nausea, it means that you will feel urge to vomit. Pain in abdomen, abdominal bloating, unable to digest the food, burning sensation in the stomach between the meal or at night. Loss of appetite, vomiting, blood or coughed out like material. Black dry stool. Now let's talk about causes of gastritis. Different things that can trigger the problem including bacterial infection. There is a bacteria named H. pylori bacteria that is the main cause of chronic gastritis. The bacteria break down the stomach protective lining and cause inflammation. The second one is the physical stress. A sudden severe illness or injury can bring on gastritis. Often, gastritis develops even after a trauma that does not involve the stomach. Severe burn and brain injuries are two main causes. The third one is medication. NSAIDs or corticosteroids, which are used to manage the chronic pain, have side effects on stomach and they can irritate the stomach lining. Alcohol abuse. Chronic alcohol use can irritate and erode the stomach lining. Autoimmune disease. In some people, the body immune system attacks a healthy cell in a stomach lining. How is gastritis diagnosed? Your doctor will ask about your symptoms and history and perform a physical exam. Your provider may also order one or more of these tests. Perform an upper GI endoscopy. GI means gastrointestinal endoscopy. This is check of inflammation in the esophagus, stomach and small intestine. Your doctor may take a small sample or biopsy of lining of stomach. A pathologist will examine this sample for anything unusual under the microscope. Perform an upper gastrointestinal series. This involves taking X-ray of your digestive tract after you swallow a barium solution. This will help distinguish area of concern. Send your blood test. This is the check for other cause of your gastritis, symptoms or signs of complication. Ask you for a stool sample. This may rule out an H. pylori infection or blood in your stool. Blood may indicate there bleeding in your stomach. Ask you to do a urea breath test. This also tests for an H. pylori infection by having you swallow a urea capsule and then seeing whether you breathe out carbon dioxide atoms. This would indicate you have the infection. Treatment of gastritis varies depending upon cause. Do not do self-medication. Your doctor may prescribe antibiotics, antacid, histamine blocker. Now let's talk about how can prevent ourselves from gastritis. H. pylori is the one of the top cause of gastritis, but most people don't know they are infected. The bacteria are easily transmitted. You can lower your risk of infection by practicing good hygiene, including hand washing. You also can take steps to minimize indigestion and heartburn. These conditions are linked to gastritis. Preventive measures include avoiding fatty, fried, spicy or acidic food, cutting back on caffeine, eating smaller meals throughout the day, managing stress, not taking acids, reducing alcohol consumption, not laying down for 2 or 3 hours after a meal. There are certain food habits which can lead to gastritis. You should avoid those foods. It includes burger, pizza, french fries, spice, chocolate, coffee. You should eat these foods: carrot, pear, apple, brown rice, banana, peas, etc. Complications. The complications which are associated with gastritis are anemia, bleeding in stomach, perforation inside the stomach, peptic ulcers, chronic atrophic gastritis. Now, this is the quick overview of gastritis. Symptoms: pain, heaviness in stomach, nausea and vomiting, heartburn. Causes: unhealthy food, uncontrolled use of medicine, alcohol, Helicobacter pylori bacteria. Treatment: gastroscopy, medicine, antacid, antibiotic. Now let's have a look at the different types of chronic gastritis. What is chronic gastritis? Chronic gastritis is a term used for when the stomach lining becomes inflamed repeatedly or for the extended period of time. When this occurs, stomach lining loses the protective cells and function. Common symptoms of chronic gastritis include upper abdominal pain, bloating, vomiting, loss of appetite, and indigestion. Although stomach irritation is common, it is not always a symptom of chronic gastritis. There are several types of chronic gastritis that are classified by different causes. Type A or autoimmune gastritis. Type A is caused by dying stomach cells and can increase the risk of cancer, anemia, and vitamin deficiencies. Type B or gastritis caused by H. pylori bacteria. Type B is caused by H. pylori bacteria and is the most common among the three. Type C or reactive gastritis. Type C can lead to stomach lining erosion and is caused by chemical irritants such as anti-inflammatory drugs, alcohol or bile.